Hey guys, so for this part of the project, the professional publication for us to pick, I picked JAAD, JAAD, or the Journal of the American Academy of Dermatology. They are directly linked to, of course, the American Academy of Dermatology, the professional organization that I picked. Again, a very widely used professional journal in the dermatology community. It is a monthly peer-reviewed publishing. So they send out new volumes every month, jam packed with all sorts of good information, ranging from like new advances in medical technology for dermatology, new diagnoses or new treatment options for diagnoses. It's even got like coding and insurance stuff, so like the paperwork side of things. It's kind of just like an overall dermatology like encyclopedia, basically just changing monthly in regards to like kind of what you need to know. For this particular project, I picked the article Surgical Site Infections Due to Razor Mediated Hair Removal in Dermatologic Surgery. This is going into, so before you have a procedure, if it is in a hair bearing area, they remove the hair just because hair has been kind of historically just nasty in regards to how it kind of harbors bacteria, and it can obstruct the view of the surgical field. So, of course, you want whoever's cutting you open to be able to see everything they need to see perfectly and have no issues. So, in this particular study, they were looking at it in dermatological surgeries because a few of them have been, or a few studies similar to this have been performed in other specialties, but none specific to dermatology. So, this particular article goes through kind of what they found. They went through a whole institution's records, ranging between January 1st of 2019 to May 31st of 21. And they were kind of going back and forth. So in a few other specialties, let me back up for a second. They kind of compared razor versus clipper to see like which would be the better means of hair removal. In this one, no one really uses clippers in dermatology, so there wasn't that to compare it to. So it was just sites that were in hair bearing areas requiring razor mediated hair removal versus sites that were not in hair bearing areas. So, like for a woman, like the center of her cheek, you don't have to shave that because there's no hair there. But if it was on her scalp, you do. Or if it was a man and you're doing his cheek and he's got a beard, you got to shave that, kind of that situation. Overall, the study came up pretty unremarkable on both ends. So with dermatology, it's kind of difficult in this aspect to compare post-surgical site infections or SSIs, just because it's a very, for the most part, superficial surgery. So you don't have or you don't run as high of a risk for infection as you do in other specialties. So like if we're removing a skin cancer off of, again, like your cheek, we're not going down super, super deep. Whereas if you are having like an appendectomy, they're going into your abdomen. So clearly a lot deeper. So we don't really run into the risk of surgical site infections all that often anyways. I mean, unless the patient's not doing what they're supposed to, which definitely happens. But like I said, it kind of came up pretty unremarkable to both ends. There was a slightly less SSI rate in in procedures performed using no hair removal process than razor mediated hair removal, but I mean, just barely. And then all of his references that he made are down here. And then the article info is over here. He does list or include some tables in here, kind of including different information or different factors that went into the surgical procedures. So it tells you the anatomic location, where it was on the body, total surgeries done, what type of repair. So linear would be like your normal stitched up in a straight line. Flap would be that the site was too big for it to close by itself. Like there's not enough skin to pull together. So they're having to basically take skin from one of the surrounding areas and kind of flap it over. I know that sounds gross, but it's not as gnarly as it sounds. And then just some other things. And then finally, like the SSI infection rate, which, like I said, pretty unremarkable on both ends. But this is just one of the many that they have. They're usually kind of structured along this line. Now, some of them have, well, most of them have charts, but I guess it just kind of depends on the author as to whether they want to include a graph or chart or not. Now, if you're the general public, you're not going to be getting the Journal of the American Academy of Dermatology. I mean, you can, but the yearly subscription is like $900. So I can't just see somebody who has no dermatological interest subscribing for that. But I mean, I guess they could. So it's kind of a given that this is written for a professional audience, but a few other like kind of keywords or like key points that kind of let you know that it's really for a professional is they don't break down or kind of use layman's terms whenever they're going through this, which you would expect for them to do if it was for the general public, because most people, if they were to read through this, they wouldn't be able to understand half of it, just because, like I said, it's not written in terms easily understood. I mean, I've worked in dermatology for 7 years, and some of these words are still kind of stumping me. So it's not something, like I said, that's like a nice, easy read for the general public. But for somebody in the dermatology field, it definitely is.